Hello, everyone. I'm Dr. Renee Mera. Today, I'll be talking to my guest on pain management for effective intervention, integrating modern science with ancient healthcare systems. This time, our ancient healthcare system that I'm talking about is SiddhaMedicine, an ancient form of healthcare system that originated in southern India. And joining me to talk about pain management using Siddha medicine and modern medicine is Dr. Shan Lakshmanan. Dr. Lakshmanan is a biophysicist from Rutgers University, Harvard certified culinary coach, and vice chancellor of Multiverse University. So tell us, Dr. Shan, you use Varmatherapy practices for effective pain management. Explain how that is done and how effective is it?
We are looking at Dr. Renee. We are talking about some science that was at a certain point. It was a handy science and technology, like we had the skills with our our grandparents. But somehow we kind of lost, and this is a very powerful technique that what I'm talking about. It can be a replacement or a complementary for the entire healthcare system, and that's what Varma is about. So Varma is the essence of our ancient knowledge from our ancient sage scientists, sage doctors who went through meditative and other techniques. They have, introspective techniques. They found a different kind of biology that we don't know yet. So they understood our body from a very total different perspective. So now we are looking modern knowledge. We have things about cellular biology. So this is an advanced biology where they found that there are 72,000 nadis in our body, very tiny little tubes that microscopes cannot detect. But they have, these points can be accessed through externally, and some internal points are there. And these external points are called varmas, and through which you can do anything in our body, even like emergency pain management, last minute things that we can do to stop certain things, example like heart attack and other things also. So it's not just in ordinary words, I can say how effective it is. It is in fact a very big replacement or complementary for, areas that modern science cannot, modern medical system doesn't have an answer for.
So we're talking of acute pain, chronic pain in any part of the body, and using Varma, which like in Ayurveda, they call it Marma, and in Siddha medicine, we call it Varma. So like these are like more or less acupressure points in the body. Share some of the Varma points over here for acute or chronic pain. Could be headaches, it could be knee pain, it could be pain in the joints. So how Varma points become effective in relieving pain?
So these points are, we trigger these points, in particular ways. They've documented more than, 153 ways, more than that possibly, because different sage scientists, different people, Siddha doctors, they have different, experiences also. So they see by triggering these points, say, for example, there is a rotation, right? There's a rotation point. So you can use your fingers to trigger those points, stimulate those points, making some rotations, or you can do some vibrations. So there are 153 different kind of things that we can do to actuate a particular point. And depending on how we do that, there are some transfer happens. There are two things that happen between the person who is healing and the person who is the receiver, right? So the the person who is healing has special training on how to pass the energy, how to get, get this energy from the universe, and then we transfer that energy. So these are special techniques. So there is a pre-technique for Varma and after technique, and use that energy. That's called the biomagnetic energy. In our ancient science, it's called the causal body or Karana Sharira, right? So in this Karana Sharira, we have, we accumulate the biomagnetic energy in our body and transfer it to that certain point in a certain way. And that energy will interact with the Varma point and release the, there are certain advanced things also, which I will tell you, like called nano reservoirs. There are very tiny little pockets of wells. There are little nano reservoir wells, right? I would call it femto reservoirs, exactly. Very tiny points in our body there, because see, whenever the nadis get blocked, say, there's a nearby point that nature has accumulated these points, naturally given us some energy reservoirs, right? Femto neuro energy reservoirs. So these femto wells, they capture that energy, and the marma points release those energies. And so that the entire pain is a blockage of the energy accumulated in one point. When the our three systems doesn't work, like the vata pitta kapha nadis, right? The different so vata nadi is the flow of the air in our body, and kapha is all the solutions, liquid in our body, and the the heat flow is the pitta nadis. So when they get blocked in a particular point, the accumulation of this life force energy, right, it becomes so huge. So we get a short circuit, and that's called pain. So the pain is a flux of that energy in that particular area. So too much pain because there's a squeezing of the nadis that is happening. So the one way of releasing that is to give a strong stimulation, so more energy goes and breaks that pathway. The other way is to healing through external massaging, triggering, so that the tube heals, the nadis get healed. And this is the way we can actually heal the body in a
So
person.
demonstrate a few points, let's say for migraines.
Yeah, say migraine. Say for example, this is a migraine point, right? It's called in Tamil, it's called the Poigai column, right? So here we stimulate, right? This is a temple, right? So if you do this stimulation like this, forward,
The index
right,
and the middle finger.
forward, right, and then you stay for some time, so 20 seconds, like little kind of light vibrations, little. So you can get like migraine and all for within few minutes. You can, few seconds, 30 seconds, you can relieve migraines. If you're keeping it for 1 minute, it's good. For if you have a little stronger headache, So depending on, there is something called the units, like how much pressure we give.
Yeah.
So that's a unit, right? It's called Matre. It's a unit, pressure unit. So those days we all have pressure units, like force, like measurement, length measurement in this. These are very important because a lot of people get confused with modern knowledge and say, hey, do 1 inch, below your nose, and then they'll put in the YouTube or, anything like 1 inch is what? 1 inch is not a measurement. So what we have to do is called ancient way. They look at relative measurement, right? For you, for each person, their fingers are the measurement. When we say angular, right? Angulars are like one finger width distance, right? So, but when you say 4 angulars, if you keep it like 4 fingers, it'll average out. Actually, it's 4 angulars. This is 4 angula. So when we say certain regions are your 4 angula from here, if you take a point, then you have to use your fingers to kind of measure this,
Yeah,
right?
and
You
use your
can
own
use
fingers. You
our
cannot say like your hand is different size than mine. So I have to use my four fingers, not
exactly,
your size.
exactly.
Yes.
Say, suppose you're you're going to do some stimulation on another person, right? So it is not your hand. Basically, you're going to use your hand, but look at the measurement. So the best measurement would be I would take a thread and measure this his finger, right? And then you can, if it's four finger, you can divide by two or make it double, it will become eight. So depending on that only, this is called the relative unit. And nobody right now in the world, they're using this method, right? Relative unit method. They go over like inches, 1 inch. If you look at all the big books that are available, that's very wrong information.
So this is more precise. Are you using any oil?
So we right now, there are special oils. See, every Varma point
Mm.
can have, different kind of, Mahanarayana, Thailam or Kaya Tirumeni oil is another oil. Like that, there are many, many oils that can be used through these Marmanadi. They're very special. Even simple, Dr. Renee, you can see that we have this kumkum, vibhuti, all this sacred ash and all, they all are marma stimulating points. They are not even, there might be other benefits, religious kind of thing. That's a different story. But they can stimulate kundalini chakras. But other than that, there is a marma point. For your example, here is what is called the Tilarthakala Varmam.
Third eye.
Tilarthakala Varmam operates in a particular time. That's why its kalam means time. So when we stimulate that, there are n number of benefits, right? Every day we are stimulating and touching that. They also call the um, transformation center.
Mm.
So what is transformation center? Tanmatra Mayam, Tanmatra center. So Tanmatras, there are 5 Tanmatras for our seeing, hearing, smelling, touch, tasting and all. These are 5 sensory transformations. For that, there is a center. So this is the center, control center for that. So when we do that, our organ, the Jnana their Jnana they their health is maintained. Then the frequency of the mental frequency decreases as you keep on touching that. That's why we have in our tradition falling into the ground, falling into the feet of a person, all these things. So basically, what we are doing is we are stimulating this point.
It
Every
also
time
helps
when
you
we do
with
it.
focusing and concentrating, especially if you're doing meditation.
Yeah, that's why all the meditations are focused, any kind of meditation that we see has to do with this. And this is also not in only the Indian tradition. It is always, this is a sacred point in many other traditions across the world. But the science is there in the Indian traditions that we learn, why we do that. So there is an answer why we do that. So these each and every marma point take different kind of thing. So like oil, there are other things like turmeric and chunam, we mix that. And that's called the kumkum, for example, right? So depending on what body type and other things, they have used different things here. So it can get observed. So transdermal absorption. So there is a method of delivering drugs, different drug delivery methods. One of the methods is the skins.
Again,
So but here we are not just looking at skin everywhere. That is there in therapy, massaging therapy and all, but mostly in the marma point there, these are very important, what you call sensitive points. The sensitive points where the cells are so very soft that the cell membrane opens up very easily there. So there is a flow intake of the medicines is very easy through this place. Transdermal drug delivery and
we also
certain
have
point yeah,
transdermal creams for the spine, so it covers a lot of organs.
right. So the but this particular through the particular point we need to stimulate and give it. then the effect will be more, right? But even without that, with bare hands, you can do many things. Without even this, these are additional things. But even people have used these methods for emergency, like in emergency, what we do, right? For example, if somebody is, unconscious, so there is a Marma point here, you can wake them up immediately,
And
right?
again, of course, you need to consult your
Right.
primary physician until you get the help is on the way. You said that you can use this point.
No help is needed. I'm telling this is not a thing that I don't want to give a disclosure that this happens, but you can take him to the hospital. But when he wakes up, he wakes up. That's it.
So how long do you say you're going to touch this point? For how long?
Well, you can stimulate clockwise, anti-clockwise, clockwise, and keep it for 30 seconds to 1 minute. And you can do this like 3 times. If he doesn't wake up in once, you can just keep doing that for 3 times, and he should most probably. I trained one of my students who can do this, and she just did it in a crowd of people in some Pongal festival or something. Like one kid, he got he was unconscious, and she used this technique, and it really worked. And everybody was saying, "How did this happen?" And she said, "I took this training from
So
Dr.
before
Shan, and
medical
it's
help
working."
came on the way, this person was already up on the feet.
Yes, that's why I'm telling. That's why you can use as an integrated practice even in hospitals, ICU, or anywhere. If it works, it works. It's not that, we can stop from taking the modern medicines. You can, do both, right? But the chances are very high. I mean, if you really have to do some real good work in the modern time, everybody, allow this to be as a practice in the modern science by understanding how this ancient biology works. Because the modern medicine, see, for example, if you ask a doctor how this thing worked, if the person who is waking up, there is no answer. There is no nerve or anything connecting. No, in anatomy, the physiology, there is no connection. But these connections are only we have to understand advanced biology. Advanced biology is like we cannot know through like common just by instrument or cutting a physical body. They are very subtler, tinier than what we understand.
So these are
Right?
subtle energy points that are in the body, but they can be seen.
Do biostatistics. What it means is I take like 1,000 patients, I stimulate on the same point, and the problem is solved. Then we can map it. So mapping can be done, right? Say Harvard has done something like that, like for acupuncture points and all. But they are struggling to find what science is. They're trying to see the connection. All the mechanism that they're talking about is modern mechanism. And that is where our ancient knowledge is needed to fulfill the gap. They know that's effective. It's working. And that's why acupuncture is one of the next level of thing that's happening in the United States. People try to approve, all these things are happening, which it's a great sign, because acupressure, this kind of knowledge went from India to China, and they, China, South Korea, and all took this knowledge. They developed it very well, right? And we have what we call the acupressure was called Marmapoints yoga in ancient science, and acupuncture was called Marma Usi Tiravukol, right? So these are ancient Siddha knowledge, and that's why in Shaolin temple we have, our Bodhidharma, Buddha, like the person's, statue there, and still, people have connections to the ancient Tamil knowledge in China,
So would you
Yeah.
say the acupressure points, Marma points, Varma points are very similar?
Yeah, see, there are, according to the ancient document, the in the Tamil literature we have around 450 say Marma points, right? So, but there are, I have learned with some masters, Those masters says there are more than 8,000 Marmapoints in our body. So it's not limited. So maybe some literature is missing or something like that. So some of the literature even went to Tibet, Nepal and all. They have, so I have seen, I worked with some experts, Varma, Marma, both experts. What I understood is that this knowledge has been taken from, the ancient Indian culture, and people used it in different places for their own purpose.
I wanted to know about the mudras. How do they intersect with the Varma Marma points?
The mudra is a similar thing. For example, mudras are also, see, the whole thing of ancient knowledge, like the Bharatanatyam dance or mudra, or any other things that are done with, like there is a Kavadi dance. Kavadi dance is a very local dance, a local dance, like anybody, like those kind of expert, they dance in the streets. So street dance, Kavadi Atam, and there is called Karagatam and all. Karagatam and all, they keep something on the head and dance and all. They all are, how our ancestors designed this is to make everything therapeutic. And this therapeutic means like how they understood the biology is the same. If you understand that from what is in the modern thing, what you do, this all they look at muscles, this physical dead body anatomy. We talk about a dead body kind of things working, that anatomy only we describe. But here they're talking about what will happen in this particular nadi when we do that. For a particular nadi, so all the tips of all the 5 fingers are associated with the 5 elements, and the 5 elements means is the 5 states of matter in the body, and also the 5 transformations. So whenever you stimulate a particular you creating a particular mudra, depends on what channels it touches, and they stimulate the entire nadi system in a particular way. So mudra is also a kind of Varma, self-stimulating Varma point. So how much energy is, internally. So by connecting the fingers, we'll just trigger those nadi points and bring back the energy in our system. So these all these things can be answered if we able to crack down the ancient femtoanatomy, which is advanced biology from ancient science.
Well, thank you very much, Dr. Shan Lakshmanan, Vice Chancellor of the Multiverse Siddha Veda University, and practicing SiddhaMedicine for 30 years now. Thank you.
Thank you, Renee. Thank you for your wonderful platform. Help people. I want to reach a million people at least, right? The whole world is good. As you said, it's bigger, but that's my target, at least million people by end of this, in end of next year. So that, at least they get benefited. And I also wanted to give this to some, train the trainers program, so they can train also and expand it. So thank you for the opportunity.
Thank you so much for watching. I'm Dr. Renee Mehra. Stay healthy, stay positive.